My background was in primarily blood vessel surgery, which included vein problems, but most vascular surgeons do arterial work. In the late 90s and around the year 2000, this new technology became apparent. I wanted to help evolve this technology, and I did help invent some of the techniques of it along the way. So I did some of this at Caraway and Health South Hospital. I was still doing artery work, and I did lung cancer work. But the vein practice was people were calling and calling and calling. And there was a time when my nurse called and said, you're going to have to do something about your vein patients. You've got a 6-month wait list. At that point, about 2005, I decided I would just focus entirely on vein disorders, and that's how a lot of this has transpired. We take abnormal vein circulation and we manipulate the pathology of it to the point that the vein circulation becomes normal.
He was president of the Alabama Vascular Society, and that's a group of people in Alabama throughout the state that are focused on vascular disease. To be a specialist in vein disorders, or phibology is what we call it, you can't really do it without understanding the other things, because there are arteries and all kinds of other things that are involved in leg pain and suffering. So to be able to look at it from the point of view where you understand the majority of other things that could be wrong keeps you from just seeing one thing when you look at a patient or look at a leg. So I think that really adds to his ability to teach and also to be just a true expert and a true pioneer. He looks at everything and he looks at the whole patient.
Every patient I work on, I take them to the car myself. Then I know when I put them in the car, they're fine, and I'm talking to their family, and I can explain everything I did, and I can tell them how to take care of their loved one. You know, we're here to take care of people and to make them better, and we find a niche that pleases us, that really that we're very good at, and that's our reason to be. Patients are smart. They shop the internet more. About half of my patients come because their family or a friend told them that I had done this initial work in the development of modern vein treatment, and I have quite a lot of experience in it now. The truth of the matter, more than almost anybody in the U.S., because I started it early. And then I helped develop some of it along the way. And if they live on the internet, they'll look at the credentials and they'll see some of that. If you're going to come to me for care and I'm going to treat you, I don't have any doubt in my mind that you're going to get the best there is. So my reward is knowing that first they're going to get better, and second, they're for sure going to get the best care that possibly can be given anybody.